So I'm going to be doing the case study about Julia. Julia is a mom of three who is married to her husband. She was referred to me because of her hemoglobin A1C levels, and they were showing signs of prediabetes. The patient states that she can't figure out a way to get into the doctors because she just doesn't have time. She doesn't have anyone to watch the kids. And then the patient understands that she knows she needs to get help, but she's just not fully committed yet. She did make an appointment in the future, but it was a struggle to get there, as well as she stated that if anything came up, she would just cancel that appointment. Patient's readiness to learn is not fully there, as she still has a lot of barriers in her life. The lack of support, time management, lack of structure, and her just not having the knowledge about diabetes. So we have Julia here, and we're going to talk to her a little bit about kind of what's going on. What are you struggling with when it comes to a support system?
Well, the kids have activities after school, and I'm driving them here, driving them there. I work, and I just don't have time for myself.
Okay, and what about your husband? Where is he in that picture? How does he fit in?
He works a lot, and I'm just taking care of the kids. So, for the most part, he's not helping out.
Okay,
I have to do the shopping and everything else that goes along.
That's super challenging, especially when it comes to making time for yourself, and that's important. What do you know about diabetes? Did they talk to you about anything, or
that my the levels are a little bit high, and that I have to control that. And first they said that you should do that with eating. With what you eat, to see if that helps.
And do you know what that looks like? Do you know what foods include sugars? Tell me a little bit about that.
No, I don't.
Okay. So sugar is called glucose. Glucose is an important source of energy for the cells that make up the muscles and tissues in your body. It's super important also for your brain, as it is the main source of fuel for your brain. And there's different levels of diabetes. So if you're pre-diabetic, what happens is your blood sugar is just a little higher than normal. When it comes to food, carbohydrates are the main source that you would get glucose from. So when we're looking at what you're eating, tell me a little bit about, maybe give me like a 24-hour diet recall.
And breakfast could be toast, eggs, or cereal, because I'm trying to get out of the house fast with the kids, and then lunchtime sandwich, or they would get takeout at work and stuff like that. And then dinner I try to cook, but sometimes we'll do fast food because we're running here to there.
Yeah, and that can be super challenging. So that's understandable. I think that's super awesome that you're at least getting those 3 meals in throughout the day. Do you feel that you do a lot of movement with your body throughout the day, or do you feel that you're not?
I don't feel that I'm doing too much during the day. I sit in an office, I'm at my desk, and then if I go to their practices or whatever afterwards, I might get exercises going shopping, or we go to the park, but it's not too much.
Okay. How do you think this is going to affect your life if you get diabetes, or just even that diagnosis of prediabetes? How does that make you feel?
I'm not too worried about it right now. I'm hoping that maybe changing my diet or something might help.
Okay. I think it would definitely help as we better understand what diabetes is and how it may affect you. I think it's important for you to know that you're not alone. There are many people with diabetes and pre-diabetic. So if we can make that shift, if that's what you're wanting, we can keep you away from having, to take any medications and stuff like that. So, I just want to encourage you that I understand that having, 3 kids, working a job, having a husband who works, it can be challenging to make time for you. Just know that that's a priority, because if you're not okay, how can you take care of your kids, right?
Mm-hmm.
So on that note, maybe let's come up with a plan. What do you feel could work best for you?
I don't know, maybe meal prep or, knowing what I should buy to eat, or meal prepping stuff in advance.
I think that's an awesome idea. I think that's a super awesome idea. I think we can come up with a plan of what you're eating, what you need to eat throughout the day. So we'll meal plan with you. We'll maybe come up with like an exchange system for you to kind of work on, and to maybe expand what you're eating. And then we can kind of go from there, see how you're doing, see how your blood sugars are doing, and then progress. Does that sound like something that you would want to do?
Mm-hmm.
Great. Well, thank you for your time.
Thank you.